He's got, you know, a foot of wool there.
And that must be pulling on his skin too,
Yeah.
mustn't it, poor fellow?
So let's shear him. He's always going to find this overwhelming. There's just no real other option. The stress of those sounds and being forced into a new position for that period of time, it can be enough to cause a heart attack, which can kill him. Right now, I'm on my way to see a familiar face, but even though I know Pam from Edgar's Mission quite well, the problem she's called me in for is apparently like nothing else I've ever seen before.
Chris has been called to a special animal sanctuary on the outskirts of Melbourne.
G'day, Pam.
Howdy.
To meet a fugitive in trouble.
How you going? Good to see you. Now, a sheep.
You've got to see this one, Chris. He's like nothing you've ever seen before. The poor fellow, he's only just come to us, and we really need your help because we've got to get him the best welfare outcome. He's in a bit of a bad way.
Let's have a look at him. Where is
Okay,
he?
he's over here.
Oh, yeah.
You'll pick him up straight away, yeah. Yeah.
Look at the size of it. When I first see this sheep, all I see is a big round mound of wool with a little face in the front. So where did he come from?
Legend has it that he survived the 2009 bushfires that in Kilmore East, and he's just been roaming through the bush since then.
So he's escaped shearing for, what, at least 5 years?
Yeah, it's amazing that he's alive today.
It's extraordinary he can even walk around with that amount of wool on.
It is, and you can see he's having a little bit of trouble walking there.
I mean, the worry I have is that he could have any sort of problem lurking underneath that wool. I mean, fly strike, any sort of skin infection in there. So really, before we even think about shearing, we need to work out whether he can handle shearing. Let's have a look at him.
Okay, as you can see our friend down here. His name's Ben Hall, and he's certainly a bit of a bushranger.
This sheep is named after a famous Australian bushranger, Ben Hall, who evaded capture for years and years and actually lived in this local area. You okay if I grab him?
Yeah, you hop in there.
Ben Hall, the bushranger, was eventually captured and justice was delivered. Catching this Ben Hall could prove to be even more difficult.
Well, it's Ben 1, Chris 0.
It's not that I couldn't catch him, it's just that I thought it would be easier and quicker
We didn't want Chris
to have you guys. With 5 years of wool growth on top of Ben, there could be just about anything lurking underneath that fleece. From bacterial infections to parasite infestations, he could even be fly-blown. Good job.
Putting the cuffs on now.
I know, it's like the law finally caught up with Ben Hall.
Chris, Pam and the boys now need to move their captive to the shed.
Yep. Let's go. So we'll walk him. Oh, he's bucking and everything.
But Ben's not going anywhere without a fight.
Okay, mate.
Okay, Ben.
Let's just go with it now. Come on.
Ben Hall is an incredible miracle. He's a testament to the will to live.
It's amazing. He's now taking 3 of us for a walk.
Just like you and I would try and survive the best we could out in the wild, Ben Hall has done that and he's done it admirably, but his time was up.
I'm going to try the impossible here. He's got, you know, a foot of wool there.
And that must be pulling on his skin too, mustn't it, poor fellow? I couldn't believe when I put my hand in, it was the length of my arm, that much wool. That is an incredible amount of wool for a sheep to have when considering we shear them, it's about that much wool.
I'm trying to listen through a lot of wool, but I can just make out his heartbeat there. So, I mean, it's certainly elevated. Just everyday life for him is a stress at the moment. So let's shear him.
Okay, let's do it, yeah.
Fiercely protective Pam can't relax. She's now worried about how Ben will cope with being shorn.
Look, the worst case scenario with these sheep is that they could suffer a heart attack because of the stress that they're under. We're lucky that we've got Chris on hand to monitor him throughout the procedure. I wouldn't have peace of mind if we didn't have that happening today.
How are you? You're shearer. Hey, Tony, I'm Chris.
Nice to meet you, Chris.
You want a hand with that?
If you can grab my toolbox, that'd be good, thank you.
Yeah.
Shearer Tony Adams has now arrived to give runaway sheep Ben Hall his much-needed haircut.
Ever seen that much wool?
No. There's 4 or 5 years on him.
Yeah, that's what we think.
We are very, very fussy with anyone who is allowed near our animals, and we have the most wonderful shearer that we've found who's very gentle and compassionate with our sheep.
Should be right to tip him. Hello, mate.
So you wouldn't grab them all by yourself?
Yep.
Tony weighs about half of what I do, but seems to have about 3 times the skill when it comes to catching sheep, because he goes pretty close to nabbing Ben all by himself.
Usually, if you tilt the head one way, roll him his back end.
Yep.
Not a good look.
That's right. Pam?
It's quickly becoming obvious why Ben has been so hard to subdue.
He's a ram. He's all man. The first thing we notice the moment Ben goes onto his back, well, it's hard to ignore. He has enormous testicles. Wow, that's quite something. Most lambs have something called lamb marking, where they're castrated, they're given an ear tag, they're drenched, they get the full works. Obviously, Ben wasn't around for that day. He escaped with everything intact.
See that? Another month and that'll be fly struck.
Yeah.
All through here. You're lucky, mate.
He's always going to find this overwhelming. There's just no real other option. Shearing isn't just like a simple haircut. For a sheep, it's a full-on audio-visual experience. The stress of those sounds and being forced into a new position for that period of time, it can be enough to cause a heart attack, which can kill him. Let's just give him a quick little check halfway through now, mate. Just...
For an animal like him, who's a prey animal, to be held and restrained and not being able to move, that's one step away from being eaten by a predator, so it's incredibly stressful for the animal.
Okay, he's coping. Yep. All right.
He's coping better than me, I'm very stressed.
I can tell. Do you want to put it on you as well? The biggest challenge that Tony's facing is the weight of that fleece is pulling on the skin. Each time it pulls the skin out, it means that those shears of Tony's all too easily nick the skin. It's the unfortunate byproduct of how much wool Ben's carrying. Wow. Amazing job.
I hope you feel better, mate.
That's a great outcome. Oh, and he's having a wee. Great.
Probably never felt so easy, has it?
That's right, yeah. Wow.
Once Tony is finished, the pile of wool is bigger than Ben. And Ben's not a small sheep, so it's time to weigh it.
He was carrying that around.
It's decent,
No
isn't
wonder
it?
he's fit.
Yeah. You got any scales, Pam? There you go. Almost 18 kilos. Not bad. Is that your biggest ever?
Yeah, definitely.
Yeah.
He's definitely a fit boy.
With Ben's excess wool removed, Chris is anxious to investigate what's causing his nasty limp.
Gorgeous, strong. Come here, buddy boy.
So he's got some arthritis in this elbow joint of his.
Right.
Now, that could be the result of an injury he's picked up, or it could be wear and tear. I'd say it's probably a little bit of both. With dogs and cats, what we say with arthritis is get them to lose weight. He just lost 18 kilos.
Yeah.
So he's going to immediately feel better on that leg
Yeah.
because he's not having to carry the weights around.
With the additional help of an anti-inflammatory, Ben's limp should soon be a thing of the past.
He's been through an enormous ordeal today, an enormous ordeal. But he's one tough sheep. He's probably the toughest sheep you'll ever meet, our Ben Hall.
It's going to look like a purple Dalmatian.
To finish, Chris is applying antiseptic spray to help heal Ben's skin and prescribing some extra special TLC.
So he's pretty close to being back on track now. His life's taken a dramatic change.
Yeah.
The one thing I'd recommend, though, is that he stays in here for the next couple of days.
Yeah.
It would be like right now for him taking a kid from the deserts of Australia and all of a sudden he's gone to Antarctica.
Yeah, wow.
It seems ridiculous because it's quite mild right now.
Yeah.
But for him, that's just been a huge change. While being shorn does seem like the end of Ben Hall's criminal ways, I wouldn't be so sure. It's been a real team effort.
Yeah.
But I think our fugitive is going to be feeling fine. I mean, he's already...
He's ready to go.
Yeah. I'd be reinforcing the fences at Edgar's mission because this guy knows how to escape. He likes his freedom. He'll be looking for it again.
As a vet, the best advice that I can give pet owners is this. Think carefully about the choices that you make on behalf of your pet, and you can literally save their lives. And if you make healthy choices, you will have a healthier pet.
Scott's making an early start this morning. He's on the road to an animal charity he often works with, All Dogs Matter.
They help to rescue and rehome abandoned dogs here in London. And they've just let me know of 4 dogs that have just come into their shelter that are in a really terrible state.
Hello.
Hello, you 4.
Waiting for Scott is animal rescuer Sonia.
Hello. Hi, baby.
Hello, you.
And the 4 new arrivals that were all saved from a local pound that could no longer house them.
They all look horrific, don't they? Their fur is in patches and tatty or even non-existent on that little Pom. Do you think we need to have a little look at her and see what's going on? It was very clear from the get-go that the Pomeranian was the one that was struggling the most. She's the one that's lost the most amount of fur. She looks in the worst condition. She's very thin. She's struggling. I can see, well, clearly the biggest problem here is her skin and the complete lack of hair. So this has been going on for a while. She's lost a huge amount of fur as a result. Who would let their dog turn into this? I mean, it's disgusting. It really shocks me to the core, and to see a Pomeranian look like that, I just don't know how the people here do it, and I don't know how their hearts don't break every day.
She's also coming pregnant.
Oh, you're joking.
So, yeah.
And what happened to the puppy?
The puppy didn't survive. The puppy wasn't even a proper pup, so it wasn't even fully formed. And so,
Sickening, isn't it? Really upsets you, doesn't it,
Yeah.
to see this?
It's heartbreaking. Everyone gets upset. You can't help it. You wouldn't be human if you didn't get upset about something like that. Sorry.
You're okay. We're going to sort you out. Hey, don't we? Can we sort you out? Hey. It's all right. Oh, hello. Hello. Wow, they're affectionate little ones, aren't they?
Come on.
All right, well, what I think we need to do is, all these guys look like their conditions are quite manageable, but this little one clearly needs my help.
Scott will now take the malnourished Pomeranian back to his Richmond practice.
There you go.
To find out just what is causing her dramatic hair loss.
She's really stolen my heart, this little one.
Say goodbye to Sonia.
Bye-bye, darling.
We all get quite attached to the dogs down here. We might only spend a few days with them, but we love them all, as if they're our own, really. Okay.
I never understand how people can be cruel to animals. They're defenseless, innocent creatures. Why would you be mean to them? Why would you hurt them or neglect them? I just don't get it.
Take care. Bye-bye.
Come on then, beautiful. Let's go and see everyone.
What's the matter with her?
Well, it's a long list of ailments that little Kylie's got going on, I'm afraid.
It's so sad. You're in good hands now, little one.
But the pint-sized Pomeranian is not the only special guest making an appearance today. Recently graduated vet Riaz is on his way to the practice for day 1 of his new career.
I've been working for this for the last 5 years, and now I can't wait to just get stuck in.
Hey, Riaz.
Hey, Scott. How you doing, mate?
I'm good, mate. How are you?
The rookie will be spending a 4-week placement at Scott's practices.
So, and here's our consult room. And it's Emma.
Hi.
This is our head nurse, Emma.
Hi. Nice to meet you.
Nice to meet you. How
Riaz,
you
new
doing?
grad, fresh off the press.
How fresh are we talking?
Oh, too fresh.
Yeah, as in like a day fresh.
Oh.
Yeah.
Like yesterday.
I'm glad the first person you met at the practice is our head nurse, because I would say, as a new grad, the person that you want to be besties with is definitely the head nurse.
So, the head vet, but you call the shots.
Yes. Yes, I do.
Yeah.
I'm glad we've established this hierarchy on day 1. Get it right from the offset.
From the very beginning. So,
Brilliant.
you, Scrubs, you downstairs, and I'll bring the dog.
What Riaz doesn't know is just how shocking his first case will be.
I thought today that Kylie would really help to flex Riaz's veterinary muscles. So guys, meet Kylie.
Oh my God.
A baptism of fire to try and understand everything that's going wrong with this dog and what we can do to help her.
Right, well, let's get started then. Look how much hair she's lost. You can see right through to her skin, and you shouldn't really be able to do that at all.
We have virtually no history on this dog whatsoever, so we have to piece it together ourselves.
When Scott told me there was no history, it was literally like a nightmare. I was like, oh, can't I just have an easy vaccination or something to do? But I'm happy to do that, so bring it on.
We're going to start at the front of you, little girl, and work our way back, eh? Here, a little look inside. Oh, darling, you're missing quite a few teeth as well, aren't you? Skin's quite darker as well in patches. She must be really itchy. This is clearly something that's just, not happened overnight.
I've never seen anything like Kylie. I think she's the first and hopefully the last time I ever see anything like that.
I mean, just looking at her tummy and her mammary glands here, she's clearly had puppies.
Well, you'll be horrified to know that just 2 days ago, she had a stillbirth at the kennels.
She didn't? Okay.
Yeah.
Wow.
Oh.
Yeah.
It's not fair, is it? When I heard that she'd lost a puppy, I lost it myself. I broke down. I don't know if it's a maternal feeling, woman to woman, but the thought of losing your baby in a stillbirth, it just made me feel for her. It's just not fair.
So, Dr. Riaz, what do you think?
I think what we should find out first is the skin problem, whether it is a simple skin problem, whether it's just a parasite or something like that, or there's an underlying cause, perhaps. I think we should start with some skin scrapes.
Riaz is now carefully scraping away the top layer of Kylie's skin, trying to find evidence of the mites that are making her life a misery.
Lovely. That's great. Good work. Good job. Good girl, honey.
But the mites are notoriously elusive and can easily go undetected even under a microscope.
Where are you little blighters? They're gonna be in here somewhere. So guys, no mites found on this microscope slide. So what are we gonna think about that?
The fact that we haven't found it doesn't rule it out. So I think what we should do in the meantime is start treating for the mites and perhaps run an additional test to confirm the presence of it, something like a blood test.
Samples of Kylie's blood will now be sent away to the lab to confirm the team's clinical diagnosis.
It seems to us that the biggest likelihood is that Kylie is suffering with mange, and the best way to kill off a mange mite is by giving the dog a bath and start helping Kylie to recover and grow that fur back. Now you've got to give a dog a bath. A very technical job.
I'm very qualified for it. Let's do it.
I know. Come on then. Are we ready for your bath?
Oh.
I know.
Here she is, the star of the show.
We don't know yet if we're treating for which type of mange, so we're just gonna hit it hard. So we're just gonna not get her face too much. This bath is not the nicest thing. We're dressed up in masks and gloves because it's pretty strong stuff, and poor girl has just stood there taking it. So what we'll do with the rest of it is just sponge it on a little bit.
You get free tummy rubs. Hey? Hey, gorgeous. The way this works is it will kill the bugs from the outside and hopefully make her feel a lot less itchy, and she can start to grow some of this hair back. If it is just some bugs on the surface, then we should start seeing some progress in the next few weeks with regards to her hair coming back. I never thought that I'd get such an interesting and a bit bizarre case as I have today.
And with me, your first nurse.
That's true. How does it feel to take... No, I can't say that.
Your nursing virginity. I can't wait to see her full of hair again. I bet she's gorgeous.
Riaz is just relieved all of Kylie's problems can be fixed. It will be several days before blood test results will confirm just what type of mange is afflicting Kylie.
There you go.
All right, honey.
Gorgeous.
But for now, this lucky survivor will return to the care of rescuer Sonia.
All right then, honey.
She'll build up the malnourished dog's strength and get Kylie ready for a loving new home.
Say thanks, Riaz.
Bye, gorgeous. You're going to sleep well, aren't you?
You'll never forget your first sort of patient, regardless of what it is. I think I'll remember Kylie forever.
All right, honey. Get you some dinner. Shall I get you some dinner?
Kylie! Well done! Look at you. Well done.
Hello, Sonia.
Hi, Scott.
My God, Kylie!
It's been 5 weeks since Scott first met Kylie.
You look incredible.
Doesn't she?
She's an absolute vision, isn't she?
She looks fantastic. Did you recognise her?
Hardly. Well, first of all, she's got hair. It's incredible.
This was how the Pomeranian looked when Scott first saw her at the rescue shelter. Severely underweight and without most of her hair.
Who would let their dog turn into this?
Into
I mean,
this
it's
state.
disgusting.
The little girl was treated for mange mites, and she's now fully recovered and sporting a whole new look.
Hair
She's
on
like,
the face.
Look at me. Look at me. Her legs.
Hair on the legs. Hair on the tail. Look at that.
Kylie looks absolutely amazing. I can't believe this is the same dog. She looks beautiful.
The blood tests have shown Kylie was under attack from the debilitating sarcoptic mange, better known as fox mange.
I think what the irony is here is that she had fox mange, and now she looks like
And
a fox.
you look like a fox.
Don't you?
You're like little Foxy.
Hey?
Foxy Kylie. Kylie is just loving the attention, and she deserves it. So I say, go, Kylie.
It won't be long now before Sonia will reluctantly allow the little Pomeranian to leave her care and go to a forever home.
She's just still there to be loved and to give love.
Beautiful foxy Kylie. Yeah. Good girl.
Rather than meeting in the vet clinic as normal, the owner of my next patient is insisting I meet her down here. Apparently this is where a problem is most visible. Hello.
Hi, Dr.
How you
Chris.
going? I'm guessing this is
thank
Millie.
you. It is.
How are you?
Nice to meet you.
You too.
Chris is at Bondi Beach, meeting little pug Millie for the first time.
Is that
It is.
what you're worried about?
It is.
It's quite something, isn't it?
It's huge.
Fiona and her son Brandon are desperate to get help for Millie's overly long tongue.
It's like that all the time. Yeah, it never goes inside her mouth.
Millie really stands out to me as being one of the most unique cases I've seen for two main reasons. First of all, it's the length of her tongue. But secondly, it's the fact she really can't pull that tongue back in. And that's what's got me confused. I mean, with pugs, the challenge is the fact that their face is already quite flat.
Yeah.
And so there is a lot that needs to fit inside a very small mouth.
Yes.
But it's too long for her normal functioning.
She was about 12 months of age when it started to come out, and it's just gotten longer and longer. When I take Millie to the park, her tongue will drag on the ground and becomes dirty.
I'm a little bit concerned because we are starting to see the signs of the fact that tongue's never really been inside her mouth.
Yeah, it does get dry.
Yeah, I mean, the end of it there is quite cracked
Uh-huh.
and also a bit swollen too. You've got to remember that dogs can't sweat, so the only way for them to really effectively cool themselves down is through panting. And a black pug like her needs to pant a lot just to keep cool. If she can't pant normally, she's at risk of heat stroke, which could kill her. She may not have been just purely born this way. There may have been something that's happened to her or some other problem that's forcing that tongue out.
Okay.
Chris wants to try and get a closer look inside Millie's mouth to find out the cause of her problem.
Is she normally quite shy around her face?
Yeah, she doesn't like being examined at
Doesn't
all.
she?
No.
The best way for me to examine inside her mouth is in the vet clinic. So if it's okay, I'd like to meet you guys back there now. We'll have a good look over her and hopefully try to get some steps in place today to turn her life around.
Sounds good.
Each and every day that this problem is left unchecked, that tongue dries out further and it becomes heavier. The heavier it is, the more it pulls out of the mouth, and therefore the longer it gets. We have to act now, and we have to act decisively. The whole idea of bringing Millie in here now is really to have a closer look inside that mouth. All I know at the moment is that tongue is incredibly long, but what I need to work out right now is the cause.
Good girl.
It's quite incredible.
Yeah?
Because her tongue never actually goes back inside her mouth.
Ever. Yeah.
It moves, it can move in and out, but, you know, it'll only move maybe an inch or so.
Yeah.
I'm just going to poke and prod her in different places to see if she responds. When I do touch around her eyes, she blinks, but slowly. In fact, she's so slow, she'll let me touch my finger onto her eyeball. That's not normal. All right. So, her heart rate's high, but her heart sounds okay. There's no nerves.
Good.
There's no irregularities there. It's impossible to know whether Millie at some stage suffered some sort of trauma to the head or maybe even was born with some sort of defect there. The nerves and the muscles aren't firing as they should, which means that everything is slowed down, and it could explain why that tongue pokes out but doesn't come back in. So I'm just going to attach this.
Chris is still anxious to get a closer look inside Millie's mouth.
Yeah.
But the little pug is still resisting.
It's not easy. This is clearly her Achilles heel, and she does not want me going anywhere near it. It's okay, I'm not hurting you. Finally, I can get my throat scope inside Millie's mouth. I don't know if you can see, but her tongue is actually sitting on what is a really thickened, swollen membrane there.
Okay.
That shouldn't really be that size.
Okay. Is that because of the size of the tongue, or...?
Well, it's part of it. The other thing is that the more a dog struggles to breathe and the more forces they're going through the back of that throat that's already small,
Right.
the more things become under stress. We need to take drastic action here, but I'm not sure how they're going to handle what I have in mind to fix this problem. What I'm proposing is we take her up to Sash, and Andrew Marchewski and I will operate on her.
Good.
So we actually need to remove a large portion of that tongue.
Is that the only option?
Yeah.
Yeah. I'm scared. I'm scared for Millie, and putting her under an anaesthetic in such a serious operation.
It's not going to be easy, but this will give her the best outcome.
Let's do it. Do it.
Yeah.
Yeah, I'm scared, but let's do it. Yeah.
Andrew, how are you, mate?
Chris,
Good to see you. Now, this is Fiona.
Hi, Fiona.
And, of course,
this is Millie.
Chris and Fiona have arrived at the Bondi Referral Hospital Sash with little pug Millie.
Come on in and we'll have a look.
Yeah, all right.
Chris wants specialist surgeon Andrew Marchewski to check out the pug's massively long tongue.
All right. It's dry and horrible, isn't it? Oh, sweet. That can't be very comfortable. Millie's tongue is obviously very confronting to look at, but it is actually also painful. You only have to touch it really lightly and she's trying to get away from you. She says, I'm sick of people looking at my tongue and poking at it. Good girl. I know. There's plenty of it, isn't there? You've just got spare.
It's huge.
Really, with a tongue like that, the only thing that we can do is surgery to reduce the size of it, because we don't, I think it's only going to get worse, and I think eventually it might even sort of die, and that'll cause her a real problem and make her really sick. So we've really got to fix this now.
The procedure Millie needs is called a glossectomy, where the damaged part of her tongue is removed.
The risk immediately is blood loss. Tongue's a really vascular organ, and it's partially that because the tongue is used in dogs for them to cool down.
Yeah.
So it's got to have lots of veins, so when they're panting, they lose heat through that area.
Yeah.
That's during surgery, but afterwards as well, if it bleeds and they get a whole lot of bruising, that can cause airway problems.
Okay.
Because suddenly they've got this big bruised tongue and they can't breathe well, so we'll have to watch that.
What will the tongue look like after surgery? Will she be disfigured at all, or...?
I think it'll be better than that.
Yeah. But it will still look like a normal tongue?
Yeah, we'll certainly, we'll try and shape it I actually use a marker pen.
Okay.
So we'll draw on beforehand and just say, OK, is that a nice shape?
Okay.
And go from there. There's a possibility that we'll leave it so you can still see a little bit of the tongue poking out. I think I'd rather go to that than take too much.
She still needs to be able to pant.
Pant,
pull
exactly
down.
right,
Yeah.
exactly right.
Yeah.
You know, especially being a black pug.
Yeah.
OK, well, let's get her in hospital.
Okay.
And we'll get this done.
Okay, wonderful.
You can see how much Fiona loves Millie, and I know Fiona just wants to get Millie out of any pain that she might be in and give her a good quality of life. And that's what we've got to do.
Look after her?
I promise I'll look after her. Come on. I've got a Millie at home too that's black Labrador, so doesn't quite have the tongue size, but anyway. All right. Yeah. Go on, Chuck. We'll get you sorted.
Yeah, I know she's in really good hands, so Dr. Chris and Andrew will look after her. But I'll be anxious until it's over.
But we're looking at really twice the length it should be there.
Yeah, we really are. Yeah, goodness gracious.
Next day at Sash, little pug Millie is being prepped for her tongue surgery.
Millie's got a really long tongue, and when you look at it, it's really dry and horrid. So we're actually going to remove that excessive part of her tongue.
Chris and Andrew will be working together to perform the delicate procedure called a glossectomy.
I think the first thing we've got to do, we've got this mark, but I think if we can make another one sort of just inside that, but just with a little bit of curve.
Yeah.
When you start cutting, all this gets distorted, and if you haven't drawn a line, you just don't know where you are, and then it ends up really ragged. So
the thing is, the tongue's a muscle, so it could easily get
contracting off. Sure.
I think I'm really happy with that.
Yeah. Now, it is going to bleed because there's lots of blood vessels all the way along this, and there's a couple of sort of big lingual arteries are up here, but the veins are along here, and they'll actually probably be the hardest to get to stop. All the blood vessels in the tongue are really intimately associated with the muscle, and the tongue is just a big muscle. And there's no way that I can work around them. So what I've got to do is, as I'm cutting through it, I'm going to cut through these blood vessels, and as soon as I do that, I'll just have to cauterize them to stop them bleeding. Actually, if you grab the tongue there, let's see if we can control a bit of these before we go too much further. We've just hit one of these blood vessels, so Chris has got his swab straight on it, and now I've got to zap it, for want of a better word, to stop it bleeding. And I've got to do it properly, because if it starts leaking later when she's waking up, that could be a bit of a disaster for us. So try and stick to the deeper tissue.
What we're using to seal that blood vessel is electrocautery. It basically runs a really small electrical current directly into that blood vessel and stops the bleeding straight away.
It's not bad. It's not too bad, is it? Let's just keep cutting.
That's the thing, is that we actually do want blood supply there. We don't want it to...
Don't want to totally stop it.
And the main one we're worried about was lingual arteries.
Yeah, it's sort of one on each side. Oh, there's one. Hello. Oh, look at that.
Straight away, that spurting of the blood tells you that we've hit the lingual artery. That pressure is quite significant. We need to get this one tied off quickly.
Swab on that one. There's one. There's no blood at all then, look. Oh, look at that. Swab on that one.
One of the biggest challenges with this type of surgery is keeping the bleeding to a minimum.
Once we do hit a blood vessel, we've got to seal it as quickly as possible. Otherwise, Millie really runs the risk of just losing too much blood.
Gotcha.
In a lot of surgeries, you can be quite tactical and really work your way around blood vessels. With this one, though, there's no choice. We have to power straight through.
It's in there, one of those veins in there, actually.
After a careful combination of cutting and cauterising, Andrew and Chris have finally removed the excess tongue.
It's a big chunk of tongue.
That's a big chunk of tongue, isn't it? Yeah.
It's huge. It's really big in size, but you look back in Millie's mouth and all of a sudden, she looks normal.
We might just take a little bit of this bulk out of this muscle out the front as well, otherwise it's going to be really non-tapered, so get ready with your swab, I think. It's important that we get the tongue shape right, because if it's sort of all squared off, I think it won't work as well as it should. So we've got to make sure that that tongue looks like a normal tongue. Oh, we're late. Go on, sort that. Grab a hold of that. Oh. Okay. Okay, great.
The final stage of Millie's transformation is to stitch up her brand new tongue.
Well, we're nearly there. Just got the last one to place now and a knot to tie and we're done. So, I mean, it's sitting nicely in the mouth. We can get it out beyond the teeth, which is what we want. And she's just going to have to relearn how to eat and drink, but...
Well, it's going to be a messy few days anyway.
It is going to be a messy few days.
Messy few weeks and months learning again,
Yeah,
but
exactly.
she'll get there.
All right.
Let's wake her up.
Make her up, I think.
Even though Millie doesn't know it, all of a sudden her life has just become just so much more comfortable.
Hey, Mill. Wait until you see the new you.
The key is the next few days. She has to stay relaxed. Otherwise, one of those blood vessels could lose its seal. If all of a sudden she does start bleeding, we have another emergency on our hands.
As Millie is wheeled into recovery, Chris can now share the good news with the pug's devoted owner.
I didn't think you'd leave.
How'd it go?
Well, things have actually gone okay.
Oh, really?
Yeah.
Okay, no issues with bleeding?
No,
Nothing
I mean, look,
unsleeping?
normal amount of bleeding. Yeah, so we managed to get through there and tie off all those blood vessels and keep everything under control, so...
So she's going to be okay?
Yeah.
It's the best news
It is.
possible.
Yeah, it is.
I really want to go and see Millie now, but I understand that Millie needs to rest to heal. So I look forward to seeing her in a few days.
The important thing for you, though, you're going to relax, okay? Because you're through the hardest part.
Thank you. I will. Okay.
I'll see you soon.
Okay, see you later. Thank you. Thank you.
I'm sure this news is a massive relief for Fiona, but I guess we all won't be truly relaxed until Millie goes home, until we know this recovery over the next few days has been a success. It's a critical time. Some swelling could develop in her tongue. She could even have a bleeder there. So we just have to remain vigilant.
Can I have a look at your tongue? Okay. We can't see it. That's a good start, isn't it?
At SASH, it's been 3 days since the much-needed surgery on Millie's tongue, and the brave little pug is recovering well.
Yeah, it is. That's a good girl. So it's a bit swollen, but it's pretty good. Hey, there we go. There we go. That looks great. Hey. I'm really happy with how Millie's tongue is looking. It's shorter for starters, which is what we wanted. There's a little bit of swelling there, but not too much, so she's pretty much right to go home. So I'm sure Fiona will be happy to get her there as well.
It's been an emotional journey for the pup's devoted owner. Fiona can't wait to get her much-loved girl home.
I'm looking forward to seeing her without her tongue hanging out and hopefully the start of a new happy life for her.
There she is. There she is. Who's that? Who's that? I know she didn't desert you after all. Hey. That's a good girl.
Do you remember me?
I think she remembers. It really is great to see these two reunited, and I know Fiona's just ecstatic with the results of the surgery. Yeah, so she's even more beautiful than she was before now. But, I think you'll find she'll be much less messier and she'll cope with eating better. Yeah, I think so. It'll take a little while to learn to use the fact that it's a bit shorter, but she'll get there for sure.
So happy. I think she'll live a lot more comfortable life. You know, she'll be able to eat and drink and yeah, with ease now. You know, whereas before she found it really difficult.
But really, no, it really couldn't have gone any better.
Yeah,
So,
Charlotte,
yeah.
which is the best news
Yeah.
possible for us.
Yeah. No, it's a pleasure. She's a great little girl. Hey, aren't you? Is it all right?
I can't thank Andrew and Dr. Chris and the whole team enough for what they have done for Millie.
actually heading out to the South Penrith Veterinary Clinic. So they've got a lot of injured animals that have been dropped off at them with burns and smoke inhalation.
Sash emergency vet Lisa Chimes has been called to a clinic near the fire zone.
Hello.
Hi Lisa, great that you could come.
Thank you.
We've been inundated with bushfire victims.
Dr. Robert Johnson has been working non-stop since the fires passed.
Over here we've got possums, and we've got more ringtails than I thought we'd get because I think they've all been displaced from their habitat. They're normally shy and secretive animals.
Oh, goodness. So, who's in here?
So this is Patricia. So she's a little female brush-tailed possum.
Patricia is suffering deep burns to her ears, face and feet.
Those burns look pretty nasty, and I think if we don't get onto them quickly, they're going to get infected, and it's not going to be good news for her at all. So at the moment, what we're doing is we're giving Patricia an anaesthetic, and the reason for that is because she's a wild animal. She's not used to being handled by people. She's got really nasty burns on her ears, almost third-degree burns. We've really got to treat these quickly, otherwise she's not going to survive this. She's burnt the tip of her tail as well. Poor little thing, huh? I'm just looking at Patricia's feet and just imagining that she was probably walking on a tree that was on fire. She's burnt the tips of her ears, she's burnt her face.
Can you see that, Lisa? Look, those little curly whiskers.
Burnt her whiskers.
Yeah.
It's just so upsetting to see burns on our wildlife. It has got to be agony. If these don't heal, Patricia's got no chance. What we're doing now is we're applying some really good antibiotic cream, and we're hopefully going to stop any infection from setting up. It's early days. I don't know if we're ever going to be able to get Patricia to a point where she can be released, but all we can do is try. She'll wake up soon, hopefully. Yeah, honey.
But Patricia is not responding.
Hey, honey, wake up. She's survived a raging bushfire. She's come out with these burns. We just cannot lose her now. And she's definitely taking a long time to wake up from this. And a healthy possum, I'm used to them bouncing off the walls as soon as we take that mask off. It makes me concerned that she's actually got some smoke inhalation in her lungs, and that's what's causing this slow wake up. I really, really hope she comes out of this quickly. Pop her into a nice warm bed and hopefully she wakes up quickly.
Oh, sweetie. Good girl. Patricia.
Thankfully, she started moving. She started waking up, so big sigh of relief from all of us, I think. Now, we just got to wait and keep treating these burns and hope like hell that they get better. We could give her some food while she's having a little
Food
lick.
now to distract her.
I want something to eat. Oh. Patricia's feeding really well. She's tucking into this pureed apple, and it makes me think that she's got a fighting chance. Oh, you're a good girl.
With the Penrith surgery full, Lisa decides to take the recovering possum to the Bondi Clinic.
Come on, Patricia, let's go. Hi, Andrew. How are you?
Good. What do we have here?
She's got burns on her feet and on her ears. They're quite bad burns, but overall she just needs a lot of care. Bye, Patricia. I'll see you soon. Thanks, Andrew. I'll talk to you.
See ya. Alrighty, Patricia. No more bushfires out here at Bondi. I'm just going to pop you into a nice cage with some flowers and a fruit salad. There you go. So the plan for Patricia now is to set her up with some food and water, give her a nice dark environment and just give her some rest. Lisa and all the vets here are going to take great care of you.
Hi. How you going, Bubbaloo? Hey. What have you been eating? Oh, look at you. You look fantastic. She is a completely different possum. She's eating really, really well. This is a good sign. How are you doing? I know. She's definitely more feisty than she was. That's for sure. Hey?
We've noticed a lot of improvement in her ears.
Yeah.
They're not resembling crispy bacon as much as they were when she came in.
Even though they're not the most fashionable ears in town, the dead bits have fallen off and now new healthy tissue is growing and this is looking really good.
Her paws have come down a little bit.
Yeah. The tips of those toes have been burnt off and they're just starting to heal. There's some blood there, which actually means that there's blood supply and the tissue is nice and healthy. So it's going to take some time for them to return to normal, but it's definitely a huge improvement compared to how they looked. Yummy.
We've been hand feeding her as much as possible just to stop her using those little hands.
Yeah, no, that's really good, and she's eating well, which is fantastic. Next time I pop in, I'm hoping to see even more of an improvement, and the way she's going, I think she's going to be just fine. You're a good girl. Good girl. You're a good little thing. Hi.
Hello, how are you?
Good. How's she going?
She's good. Her skin has healed very well.
Oh my goodness, look at those ears.
And she's got her spark back, so she's pretty keen to...
You want to get back out in the bush, huh? Yeah. There you go.
Alright, sweetie.
Wow, Ali, that is just a massive improvement. They were red, raw and oozing and completely scalded, and now that's just normal tissue. So
yeah, I'm amazed how well they've healed because there was barely any skin there.
They're pretty amazing, resilient animals, aren't you, sweetness? When I met Patricia, she was this poor, helpless burn victim. And then I look at her now and she is full of beans. Her paws have healed up, her whiskers have grown back, and she's ready to climb up that tree again. Come on, Patricia, let's go.
Just had a desperate call from a lady who's really worried about a puppy who's just unable to use a leg, so I'm trying to get there as soon as I can.
Hi, Chris, come in.
Thank you. You're Sheena?
Yes, Sheena.
Nice to meet you.
You too. This is Munro and this is Millie.
Okay. Which is the one with the problem?
Munro.
Just want to see how she goes here with her sister. Come on, guys. Here. Here.
She's unable to take more than a few steps and then just falls to the ground, her legs fall apart. She's very tired, she gets breathless easily. Come on, quick, puppy, come.
Come on.
She's trying.
You look in those eyes and she's incredibly frustrated because she wants to be a puppy, but she can't because she can't move. Come on.
Munro, come.
Come on.
Come. Good girl. Good.
You expect that puppies are going to be a little bit clumsy, but you never see this situation where those legs just slip out from underneath them and they collapse. The concern I've got is that if she can't support her weight when she's 5 weeks old and weighs, you know, a couple of kilos, what hope does she have when she's 20 kilos?
Chris has a suspicion about what's causing this severe condition. He's hoping he's wrong.
You almost see her chest almost goes inwards. It's almost concave there. The big thing I notice is her chest. It feels flat. The sternum doesn't have any great point to it, and her chest doesn't have any depth, and that's just a classic sign of swimmer syndrome.
This deformed chest cavity forces the puppy to lie flat, compressing its lungs, causing difficulty breathing and lethargy.
It is almost like she's swimming.
Yes.
You just see her legs spreading out like this, like she's almost doing breaststroke.
Yeah, it looks like she's swimming.
This condition is pretty rare. A lot of vets go through their entire career having never seen a case of it.
Munro.
Little one, come on.
I've heard most people put these dogs down. I couldn't do that. I'm just hoping that he can help her. Come on, Munro, come on.
50% of puppies that have this, that aren't helped out, will die. We need to actually act fairly quickly on this, because if we don't do anything, then this will be her.
Yeah.
And it's not much of a life.
No, it isn't.
What I might do first of all is actually just get a weight for her.
That'd be great. Millie?
Millie first. And what about you? Okay, so she's a little bit smaller, which we'd expect given the fact she's had, I guess, this slower start to life.
Exactly.
I know you just want to sleep, but we do need to see how you get around. Okay?
It's so obvious just how much of a difference there is between these two puppies. Not only is Munro 10% lighter in weight compared to Millie, but you look at her and there's just no energy there.
She should be playing all the time, having a little cat nap, up again playing, but she just doesn't want to participate.
Now, Munro, your sister's going to take the hit first up, all right?
Chris will compare x-rays of the puppies to confirm how severely affected Munro is by swimmer syndrome.
My feeling is that Munro's is going to be quite significantly flattened and compressed, and that's why she's having trouble getting around, that's why she's having trouble breathing, and could explain everything that we're seeing. If we look at Millie's x-ray, yeah, see, there you go. So that the sternum's come further down and it's also at more of an angle. So if you flick between the two, then you go to Munro's, it's higher and flatter. And that's the classic sign of swimmer syndrome. Because so many of these puppies are put down, there's no clear, designated way to fix these guys. So we have to be a little bit creative, have to come up with our own way of fixing her. For her treatment, the first thing I want you to do is some physio. Just squeeze her chest on either side to force that sternum forward. She also learns how to support weight on those back legs too. What makes this so different to any other challenge I've faced with a dog before is this isn't teaching a dog to walk again. This is teaching a dog to walk for the first time.
I just don't like to see her in pain, but, well, nobody does, but yeah, we have to do these things to help her.
I guess we have to realise here that there are no guarantees that what we're going to do with Munro is going to make a difference, but you have to try, because if you don't, she's going to be locked in that splayed position for life, and that's not a life. Sheena?
Hi, Chris, how are you?
Good, how are you?
You off to the beach?
No, there's a purpose behind this. You'll
Really?
find out, yeah.
Chris is stopping at Sheena's house to try out an invention which he hopes will help Munro walk.
Look, it's a present for you.
Look at this.
Oh, this looks nice.
Nice. Munro's about to experience the next part of the therapy. This has a plaster mould inside it. This actually means that her chest can't lay flat.
Okay.
So it's like a big V there. This will actually push the weight out to the side of her chest
Yep.
and in a way do what we were trying to do before
With the exercises.
with the exercises.
Great. Look at this. New wardrobe. Millie will be jealous.
Hopefully that sternum of hers will actually grow outwards and let her lungs really expand. She's all bound up like a leg of lamb at the moment.
Oh, that's it. I'm not too sure about this. She does look like a leg of lamb.
We're not in the greatest terms right now, are we? This is one of those ideas I had swimming around in my head. It, should have pointed out it wasn't a finished idea.
It's like a little G-string.
It wasn't my intention to make your dog a G-string. But yes, it does look like a G-string, all right? My invention's taken a few little adjustments, but in the end, it's doing its job.
Good girl.
It's good girl. Come on.
Great.
Hey, look at you go.
Wow.
Munro is only 5 weeks of age, so in the best case scenario, she'd only need to have this harness on for about 3 weeks until her chest is reshaped, she can get more air into her lungs, learn to walk properly, then the harness will be a thing of the past.
That was a good trick.
There's just one more component to Munro's full body workout. After all, what's the best exercise for a swimmer? That's very good. See, she's running.
Good girl.
She's essentially running there. The movement of swimming for a dog is exactly the same as the movement of walking. She's motoring. I mean, she's never moved those legs this fast ever before. This is the only swim school in Australia where dog paddle is actually not only allowed but encouraged. If there was ever any doubt, this just proves that those back legs, they work. They work perfectly well. They just need to know how. This is teaching her how.
I never expected to see her swim. I thought she would just cry a lot, but she actually swam, which is fantastic. Those legs work.
Look at you go, huh? Look at you.
The water therapy is already making a difference, but there are still no guarantees Munro will ever be able to walk normally.
Final instructions, exercises, funky new outfit, aqua aerobics. You got it? You do that, you might be okay. I really think between the family's commitment and little Munro's determination, this is a team that deserves to succeed. So you just hope they will.
Here he comes. Woo!
Hello.
Run, girls, run, run!
Oh, look who's at the front. Hey, our swimmer got her land legs back, huh?
Happy as Larry?
It's 3 weeks since Munro's therapy began and the little Staffy has made an amazing recovery.
This is part of the physio now, is it?
Yep.
Munro's caught up and she looks fantastic. Everything about her screams out normal puppy. I think it's pretty safe to say she's making up for lost time right now.
Oh, she's full of life. Yeah, she does everything the other one does. If you didn't know anything was wrong with her, you would never know that there was something wrong with her. Come on.
Incredible transformation over just a few weeks to see her go from just being a really sad little girl to watch to now being so happy in every step she makes. And a lot of people were saying that Munro didn't have a life to lead, but we took a chance and you can see today it was a chance worth taking.
You've cured a swimmer puppy. How good does that feel?
Hi, I'm Dr. Danny Busek. If you love our show and want to see more amazing stories from the Bondi Vet team, just hit the subscribe button. Click that little notification bell and we'll see you for our next video.